I'm Dr. Tyler Teffenhart. I'm an internal medicine resident over at Baylor Scott and White Texas A&M Health Science Center in Round Rock. Here I have a case presentation of a rare cause of miliary pattern lung disease in a patient with a history of TB. On this project with me was Dr. Callie Fort, Dr. Chakrapani Pathiconda, as well as Dr. Ojas Vyas was the attending overseeing the project. All members of the internal medicine program over there in Round Rock, Baylor Scott and White. So just as an introduction to talk about the case, a chronic cough and a miliary pattern on a chest imaging have a broad differential, including bacterial infections, fungal infections, immune sources, and lastly, malignant processes. We report a case of a 53-year-old female with a history of a latent TB who had completed a 6-month treatment with isoniazid upon immigration from a tuberculosis endemic area, who presents with a 5-month history of cough, fatigue, weight loss, and night sweats. So just as a quick case summary, a 53-year-old female with a history of latent tuberculosis treated, as I said, with the 6 months of isoniazid, presented to her PCP with a 5-month history of cough, weight loss, and night sweats. She immigrated from the Philippines about 35 years prior. She concurrently experienced about a 10-pound weight loss, which for her was about 10% of her body weight. Very thin lady. On physical exam and vitals were unremarkable. Chest x-ray showed diffuse pulmonary micronodules concerning for miliary tuberculosis, as you can see over at the x-ray of figure 1A. The patient was sent to the emergency department after consulting with infectious disease, who was concerned about this miliary tuberculosis. Labs just showed an elevated alkaline phosphatase with both the bone and liver isoenzyme elevated. Labs were otherwise unremarkable. Chest CT showed innumerable pulmonary nodules with a dominant nodule in the left upper lobe, a small left-sided pleural effusion, pleural thickening, and multiple sclerotic osseous lesions. As you can see, the diffuse micronodules at figure B. Infectious workup was negative, so an endobronchial biopsy was pursued, showing poorly differentiated adenocarcinoma. The molecular analysis showed the EGFR mutation. Staging showed bone and brain metastasis. She underwent radiation to the pelvic and sacral metastasis and initiated a tyrosine kinase inhibitor for treatment. 1 year later, she showed no evidence of metastatic disease on imaging, so pretty successful treatment. So as I talked about, the figures are both there, figure 1A and B. So just as far as the discussion, lung adenocarcinoma is the most common primary lung cancer with a mean age of diagnosis of 71 and has a male predominance. It is discovered incidentally or commonly discovered incidentally on imaging in asymptomatic individuals, but can also present with a cough, unintentional weight loss, shortness of breath, and hemoptysis. Well-known risk factors include tobacco use, occupational exposures such as silica, asbestos, radon, heavy metals, and diesel fumes. And just a kind of a highlight of our case, a past tuberculosis infection is a lesser known independent risk factor for developing lung cancer in young patients, regardless of smoking history. The differential of the miliary pattern on chest imaging include bacterial infections such as tuberculosis, mycoplasma, nocardia, fungal infections such as histoplasmosis, blastomycosis, immune sources including hypersensitivity pneumonitis and sarcoidosis, and lastly, malignant processes, especially EGFR positive non-small cell lung cancer. Due to the risks of the early brain metastasis associated with the EGFR positive lung adenocarcinoma, early diagnosis and treatment is vital. And just to kind of re-highlight some of the points I mentioned previously in the poster. So the wide differential, there's obviously a wide differential for this chronic cough and miliary pattern with etiologies with significant overlap in clinical presentation. A past infection with tuberculosis is a lesser known risk factor of lung cancer in young patients independent of smoking history. And then lastly, the miliary pattern lung cancer is concerning for EGFR positive adenocarcinoma, which has been associated with distant metastasis to the brain, making timely diagnosis and treatment crucial. And with that, happy to answer any questions or any interesting things you guys would like to discuss about the poster case.
Thank you very much for that presentation. There were no questions in the chat box, I believe, but I was going to ask you, is she now totally disease-free on the immune modulating medications that you used?
Yes, sir. Currently, so the last time I kind of checked in on her, I was following up with her in this oncology clinic. I just happened to be on the oncology service during her follow-up with Dr. Vyas. And yeah, based on the scans, no evidence of metastatic disease based on follow-up CT scans.
So how long have the immune modulating medicines been utilized for primary lung cancers, particularly, a bare few years ago, this would have been a death knell for someone.
Yes, sir. No, I'm not exactly sure when it was approved. I know I had talked to Dr. Vyas about it, and he had said he is about 5 years outside of training. And he said that they really caught on during his fellowship training about 5 years ago. For the patient in this case, she had received treatment for about a year on the immunomodulators, and really very successful.
And we've seen the same with melanoma.
Yes, sir.
And Jimmy Carter is a living evidence to having had brain metastases and has had immune modulating medicines. Do you believe that the TB, the past history of TB and this were connected then?
Yes, sir. I think she was relatively young, 53-year-old female. So a little bit more about her as well. Every year she would run an additional mile as far as for her 53rd birthday, she ran 53 miles, and that was about 5 months ago. So she was in incredible shape, never a smoker, stayed away from any drugs, no exposures. And the only thing we really could point to was this past latent TB that she had experienced in her youth and had been rid of, as far as we know, for the last 35 years.